यार ये ipill खाने से abortion हो जाता है क्या? Why do all doctors say this is bad? How does it even work? How can you have sex, have a pill, and then not get pregnant? Hi, my name is Dr. Tanaya. You probably know me better as Dr. Cuterus, and today I am here to tell you all about emergency contraception. Emergency contraception is exactly what it sounds like. It's meant to be used in an emergency, and it is contraception, which means it prevents conception, which means it prevents a pregnancy. Contra means against, so if you're going against conception, you're doing contraception, and you might need to use this a lot of times. For example, in case you've used a condom, broken the condom, forgot to use a condom, in case your birth control has failed, and unfortunately even for non-consensual sexual acts. Emergency contraception is very important and very useful, but it's very important to not abuse emergency contraception. So let's learn what it is, how it works, and what are the side effects. So on the sides of the uterus, you've got the ovaries. The ovaries make and release the eggs every month, and when the egg and the sperm fuse together, you get a cute little baby. If you can prevent this egg from being released in the first place, that will prevent that egg going on a date with that sperm, fusing and making a baby. So the first thing that emergency contraception does is that it delays or it prevents this egg from being released. The second way it can work is that even if the egg does go out on a date with the sperm, it will prevent it from latching on. When the combined product of that date happens, the fetus or the embryo, it will prevent this embryo from latching on the inside lining of the uterus. This is called implantation. So essentially, you will not let the couple come back home after a date. And this is how emergency contraceptions can prevent a pregnancy. You can buy these hormonal pills at the pharmacy and you can have them on your own. It's very easy to have. They usually come in packs of 2 or they come as a single dose, and you can have them within 72 hours of unprotected sex or contraceptive failure. Very simple, right? Just take the pill, swallow it with some water, and you'll be alright. Now, a lot of people tend to experience side effects with using hormonal contraceptives. Emergency contraceptive pills, on the other hand, they can have a range of side effects ranging from tender and sore boobs to irregular bleeding. A lot of people experience bleeding right after being on an emergency contraceptive pill. So, you're expecting your period in 3 weeks, but you get your period right away. This is one of the ways the pill works. So, this is also normal. Aside from this, you may also experience nausea, which is wanting to vomit all the time. Or you can experience headaches. Some people even have slight allergic reactions. If this is something that's happening to you, you run to the doctor. Now, once we've covered what happens, we have a whole gamut of issues that can crop up. Like I mentioned, from headache to sore boobs to nausea, vomiting, feeling really tired. We do need to understand, aside from these side effects, what are the long-term side effects of emergency contraception. And here I'm going to give you a very tricky answer. The tricky answer is that although emergency contraceptives don't have a long-term effect on your fertility or your health, you still shouldn't be using them as your regular contraception. The reason why I'm saying that is because regular contraception is cheaper, comes with fewer side effects, and is definitely more effective. The emergency contraceptive pills come with a very heavy dose of hormone. They change your regular natural patterns of your menstrual cycles. And because of this, you can have some very troublesome side effects, and nobody wants that. Why not just rely on good regular contraception? For example, things like condoms that not only prevent STIs but also keep you safe from a pregnancy. So double advantage. And aside from this, there are other hormonal contraceptive options that you can find out from your doctor, get an idea, and use them safely.
Subscribe to our YouTube channel and hit the bell icon so that you don't miss any videos by us.